Hi everyone, my name is Emmanuel Ogbodo. I'm a specialist biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. I completed my PhD in biomedical science. For many years, I've helped a number of people to navigate through interview questions that help them to secure their dream job as a biomedical scientist or as a specialist biomedical scientist. And I'm here to help you to navigate interview questions, therefore increasing your chances of getting a job as a specialist biomedical scientist or as a biomedical scientist. I will ask that you like, share, comment, and subscribe to our pages. Thank you. Hi everyone, so today we are going to look at antibody panel. So this will be part 2. Okay, so let's look at it in detail. Now, before I continue, I had already made a video on antibody panel. That should be part 1. So I would really recommend that if you've not watched part 1, do go and watch part 1 before watching this part 2. Okay, so that you will follow it in order. So we're going to look at interpretation of antigram. So in antibody panel, depending on what the hospital chose to call it, they can call it antibody panel, they can call it antigram. Okay, so which any way they can call it antibody identification, whichever one they call it, okay, they all mean the same thing. Okay, so it basically means trying to interpret or try to understand the particular IgG antibody that patient has got. So I'm going to start by explaining to you the rules. Okay, so that's why it's part 2. Okay, so there are rules here. So I'm going to tell you again, if you want to work in blood transfusion, hematology and blood transfusion, I would recommend that you get yourself acquainted with BSH guideline, that is British Society Hematology guidelines. Okay, you're going to see a lot of things there that can actually help you. Okay, so one of the guidelines, they say something like always do your best to exclude all clinical significant antibodies. Okay, so I'm going to make you are going to see detailed slide on that. Okay, I know they've given an example, but I'm going to give you some detailed slides. So when we are doing antibody panel, which is what I'm going to be doing in this part 2, we're going to do our best to exclude all possible clinical significant antibodies, meaning that there are clinical significant antibodies and there are non-clinical significant antibodies. And when I get to that slide, I will explain exactly what that means. So in number 2, again, of course, you have to antibody exclusion. You need to the presence of some of these antibody. Okay, so we're going to that talks in terms of whether it is homozygous or heterozygous antibody. But on this particular video, I'm not going to be talking about heterozygous or homozygous. That will be part 3. Okay, so that's why I want you to watch it in order, because when we get to homozygous and heterozygous, you're going to see some more complicated things. Anyway, let's continue. So you also have also these are different rules. Okay, antibody identification specificity should only be assigned when the plasma is reactive with at least 2 examples of reagent red cells expressing the antigen. Okay, don't worry about this whole thing. When we get to the practical aspect, I will make it very simple for you. Now, I did mention about enzyme panel. Okay, when we are looking at antibody panel in the that should be the part 1. Okay, so but I just decided to include this here because in this enzyme panel you are going to see that is basically talking about enzyme treatment treated with the papaya. Okay, so they are used because it contains some enzymes, and that's why they use them to make that enzyme panel. But remember that we'd already mentioned in part 1 that these enzyme panels, okay, they are those panels or those panels that can destroy some antibodies, while they can also enhance some antibodies. And these are the example, and we had already looked at that in detail during our part 1. So anyway, let's go ahead with what we are here to do. So this dosage effect, I'm going to explain dosage effect, but we're going to need this more when we get to homozygous or heterozygous antibody. That is when we are definitely going to need this. But let me explain it. So what I want you to think about is that, so when antibodies, this IgG antibody, some of them come from the same family. Like when you say Kel antibody, and when you say something like Dufy antibody, like Dufy A and Dufy B. But the example that is given here is JKA antibody, okay? So you have JKA, you have JKB. They are from the same family of antibody. So what happens is sometimes, there can be competition of them trying to bind to a particular site, and that can affect the level of the reaction. Let me explain it this way, okay? So that this can be very more helpful. So if you look at this, it's trying to say that here is only JKA. Here it is only JKB, but here it is JKA and JKB. What does that mean? It means that when it is only JKA, you are going to see strong reaction. When it is only JKB, you will see strong reaction, meaning that when JKB or JKA, only JKA or only JKB bind the red cells, okay, it will bind very strongly. But when it is two of them present, there is going to be competition. Therefore, they will share the binding site, or they will compete to the binding site, and that will affect the degree of the reaction. In other words, when you see something like this here, are you getting me? The reaction may be weak, and in some cases, depending, you may not even see anything, okay? But when it comes to something like this or this, okay, you are going to see that there is going to be strong reaction. So this information will be more needed when we get to the homozygous and heterozygous antibody. But for now, that's not my business today. So let's crack on. So now, I had already mentioned in my previous video about antibody panel that the strength of the reaction is dependent on what you can see. So you can see this is 0 because the cells all go down. But here you can see that this is +1 because it comes a little bit up, then +2. So the more up it goes, the more the plus. So here it's +5, because it is very high. Don't let this confuse you. If you go for interview, they may not even give you +5, you might get +4. But like I've said, whether it is 1, in fact, whether it is weak, which is W, 1, 2, 3, and so on, it means that it is positive. So you need to consider that. Okay, right. Let's look at clinical and non-clinical significant antibody. Now, one of the things that personally I worried about at the early stage when I hear about this clinical and non-clinical antibody, I was like, how possible? Because all the antibody really should be clinically significant. So I don't want you to think less of some of these very antibodies. Every antibodies, they are clinically significant. Therefore, why are some of them non-clinically significant and some of them are clinically significant? I will explain. So sometimes when you look at the percentage, the probability of seeing some of these very antibodies, that can determine. Okay, for an example, remember that all the IgG antibody, they are going to cause hemolysis. Each one of them causes hemolysis. But what happened is this: there are some antibodies that are commonly seen. So those ones that are commonly seen, based on the percentage, the ones that are commonly seen, they are mostly clinically significant antibodies. Where there are some of them that it is very rare to see. Most of the red blood cells are going to have those antigens negative. Those ones cannot be regarded as non-clinically significant antibody. So I don't want us to worry so much about why is this one clinically significant and the other one is non-clinically significant. It's just based on the probability of seeing them. What it means that most of the red cells you are going to give, even if the patient has that antibody, most of the red cells you are going to get will have that antigen negative. So they are non-clinically significant. Okay. So now if you look at the clinically significant antibodies, you can see anti-D is there. So I've used yes or no for that. Okay. So clinically significant antibody, anti-D, yes. So you see anti-big C, anti-little c, yes. Anti-big E, anti-little e, yes. They are clinically significant. JKA, JKB, yes. Anti-M. Remember that I think I was trying to talk to you guys about, I think when I was talking about the factors that can affect blood group and antibody screening and antibody panel, I did mention about some cold antibodies, okay? And one of the examples is anti-M. Anti-M is clinically significant, okay? But remember that some of the anti-M can be cold. Some of them you cannot identify them at 37 degrees, okay? So you might need to identify them. Some of the cold anti-M can then be identified, at a lower temperature like 4 degrees. So you need to incubate it at 4 degrees using fridge. So anyway, those ones that can be identified at 37 degrees, they are clinically significant. Okay. Then anti-big S, anti-small s, clinical significant, yes. Anti-Dufy A, Dufy B, they are clinically significant. What are the ones that are non-clinically significant? You have KPA, you have CW, you see LUA, anti-N, and anti-N, of course, anti-P1, anti-LUEA, and LUEB. Now, what will I tell? So, what it means then is that, as a background, I want you to understand it because we're going to need it as we start interpreting the result. What this means is that when we are identifying the antibody, we need to consider the clinically significant antibodies first. We need to consider them. Make sure that we exclude them before we can say they are not present. But even if we are suspecting these ones that are non-clinically significant, we are not really worried. Let me give you an example. What it means that if I'm suspecting antibody LUA or antibody CW or antibody KPA, I may not necessarily be worried about it because they are non-clinically significant, and I have explained why. Because most of the red blood cell anyway is going to have that antigen negative. Okay, good. So let's look at this example here. Let's look at this example. So if you look at this example, so this is example of the antibody. Okay, so this is a panel sheet. So these are your panel sheets. Okay, these are the results here. Okay, so if you look at this result, you are going to see that these are the results you've done. This is your IAT. So I've already told in my previous video that what you need to do is to match what is here, either this way, that way, and so on. Match the pattern of this. Did it match any of this? Okay, that is what we are going to do. That's the pattern. That is the beginning of what I want to do. But I'd already made this video. This was the pattern I showed you, when we were looking at in part 1 antibody. I'm going to do something slightly different. But before I explain it, let me go to the next slide. So if you look at the next slide, you are going to see that obviously you can see this is circled, that this is Dufy A. So if you look at this mark, you're going to see that this pattern of the reaction matches the reaction of what you can see here. Because of it matches what you can see here, that is anti-Dufy A. No other pattern, M, N, big S, small s, or B1, or LUA, or K, big K, small k, KPA, all these other antibodies, none of them matches this apart from, the only one that matches it is FYA. So that is why you can say that this is antibody Dufy A. That was what I told you in part 1. Now let's look at another rules. So anyway, this is antibody Dufy A. From what I said in part 1, this is still simple to identify. But let me give you another secret. Now, what I want you to understand here, before I explain this further, what I want you to understand that there is a rule. The rule said that if you have negative results on your panel sheet and you have whether positive or negative, okay, it does not matter. Let me explain it again. So if you have negative, like M is 0 here, even if this is 0 and this first one is positive, it does not matter. You cannot exclude antibody, a particular antibody, because on the result, on the panel sheet, it was negative, but the result was positive. You should not exclude that antibody. The only time you can exclude antibody or cancel the antibody is when there is a positive on the panel sheet, but the result is giving you negative. Let me repeat this again, because this is very, very vital. That is all I want to teach you today. Now, when you have a negative result, 0, on the panel sheet, but the result on the patient result, whether it is 0 or negative, it means nothing. You should not cancel that antibody. You should not exclude that antibody on that basis. You should only exclude antibody if it is positive on the panel sheet and negative on the result, on the patient result. Then you can exclude it. Now let's look at the practical example, and I'll go straight to where it was marked, where it is marked red. So if you look at, even though that, look at this M here is 0, M here is 0, M here is plus, M here is of course plus because it's 4, 0, 0, okay? But look at on cell number 4, it is positive, but cell number 4 on the patient result, negative. Therefore, you cancel, you know that it can be M. That is how you can exclude M now. So because it's positive here, but negative on the patient result, that is how you exclude it. If it was the other way around, let me see if I can find an example. Like if you look at cell number 8, it was 0 on cell number 8. You can see 0 here. But here, if you go across, you see it's positive. You cannot exclude it that way. You should not exclude antibody because the result on the panel sheet pattern is 0, but the patient result, positive. You cannot exclude. You can only exclude when it is positive on the panel sheet and negative on the result. Then you can exclude. I hope I've made that point very strong. So now on panel 4 on anti-M, positive, negative. You cancel it. It can be M. Let's go to N. Positive on the cell number 1, negative on the cell number 1 of this result. You cancel N. It can be N. Then let's go to small s. Okay? So with the small s, you also cancel on cell number 4 because it's positive on cell number 4. You can see cell number 4 positive. Then cell number 4 negative. You cancel small s. Sorry, you cancel big S. So it can be big S. Look at the small s. Small s is positive on cell number 1. But here, the patient result is negative on cell number 1. Then you cancel that small s. Now, let's look at P1. P1 is 5, of course, which means positive on cell number 1. And the patient result, of course, is negative. Then you cancel it. Then let's look at LUA. This is a good example of what I'm trying to tell you. Provided that it is 0, don't cancel. You only cancel when it is positive and negative on the patient result. So, for an example, even though that it is 0, LUA is 0, which is negative on cell number 2, but the patient result is positive, you can't cancel it. You cannot exclude it that way. Okay? So now, that's why we excluded the LUA on cell number 10 because it was positive, while on cell number 10, the patient is what? Negative. Then you exclude. Then come to K. When you come to big K, you see that on cell number 6, it was positive. Okay? Then on cell number 6 of the patient, it was negative. Then you exclude. So that's the pattern you are going to see. Okay. Then you come to KPA. Can we exclude KPA? No, we cannot exclude KPA because even on cell number 8, okay, KPA is positive, and you cannot exclude from what I said from the 0. Okay. So we suspect KPA. Then when we come to LUA, we exclude on cell number 3 because it was positive and it was negative, so you cancel that. So at the moment, we are suspecting KPA. Okay? Anyway, so we'll go over to the LUB. LUB is positive on cell number 1, negative on cell number 1 of the patient, you cancel. And we already know that this antibody is Dufi A because 0, 0, plus because it's 4, 0, 0, 0, 0, plus 0, 0, plus 0, 0. Okay, so the pattern matches FYA, but we are not excluding KPA. Don't forget, because it's positive on cell number 8. It is positive only on cell number 8, and of course cell number 8 here is also positive, so we cannot exclude. Okay, now you come to FYB, positive on cell number 1, okay, negative on the patient sample, then you cancel. You come to JKA, positive on cell number 3, negative on the patient sample, cell number 3, you cancel. You come to JKB, positive on cell number 1, negative on the patient, so you cancel it. Therefore, once you view that cancellation method, you can see that obviously we know that it is FYA, but we are not excluding KPA. That is all I'm trying to teach you today. Okay, so please make sure you get that. So let's get to the next. If I'm going to explain that result that I've just shown you previously, okay, what I'm going to tell you that is obviously it is Dufi A, FYA, okay, but then we are suspecting KPA. Okay, so I would say antibody DFA and KPA. But remember that KPA is one of the known clinically significant antibody. Okay, so that is why I'm not going to bother about it. I'm just going to concentrate on getting the antigen FYA negative and cross-matching for that patient. So anyway, this is your turn. Like I've said, what I would want you to do is to have a go. So when I show you antibody panel, try to pause that panel, work it out first, okay, before continue watching the video. That way, whatever thing I say, you then compare it with what you worked out. That way you will know whether you are following or if there's any way that you might need to improve. Yeah, okay. So let's go to the next slide. Yeah, again, so this slide again talks about the effect of papaya. That is the enzyme that I showed you about papaya on the previous slide. So basically, it has the effect it has, the papain, the effect it has is the enzyme activity. Okay, so meaning that with that enzyme activity, it can be able to enhance some antibodies and it can be able to destroy some antibodies. Once again, you can see that obviously it has also been shown you here that these are the antibodies that it can enhance and these are the ones it can destroy. Please don't forget the definition of enzyme panel. If I were you, I'll try to remember the example of the enzyme of the antibody they can enhance, which are these ones, and the ones they can destroy, which are these ones. Okay? Yeah. Let's look at the next slide. Right. So now we are going straight to the cases. Okay. So what you are going to see that I'll present the cases and I'll go through it. Okay. But I had already said, please, when I present the cases, pause the video. Try to work it out from what I've said, okay? Then compare my answers. Anyway, so that is where it's going to work. Show you your turn, okay? I'll show you case one, like any cases. I'll show you the case. Then you try to have a go, see your answers, then compare it with what I'm going to be saying, okay? So the answers I need here is actually your own answer to compare it with my own answer, okay? Let's get into it properly, okay? Yeah. Let's look at this one. So if you look at this, so we have two panels. We have IAT, we have enzyme. Okay. Now, if you look at this, we're going to use cancellation method from what I've taught you. So because it is C here, positive here, negative. So we're going to look at IAT. Okay. First, positive here, negative, we'll cancel C. So before I continue, I'd already told you that in panel antibody identification, you have first line panel, second line panel, and so on. So IAT, I've told you guys as well that enzyme panel cannot be the first line panel because it destroys some antibodies. Okay, so we're going to first of all focus on the IAT. So anyway, we cancel the C because C is negative on cell number one. Cell number one. Sorry, we cancel C because it's positive on cell number one, but negative on cell number one of the patient, so it's not C. We'll cancel it. Okay. The same thing is applicable with D. D is positive on cell number one. The cell number one here is negative. We'll cancel D. It can be D. E then is 0, 0 plus, okay, 0 plus. So this pattern matches this pattern. So this person will have anti-big E. So the result, the IAT of this patient matches this very E. So it's antibody big E so far, okay? Because look at it, 0, 0, 0, 0, okay? Then you have plus, okay? Then you have 0, okay? Then you have 0, then you have plus, then you have plus, and the rest is 0. So you can see after this, the rest is 0. So it matches E. So at the moment, we know it's likely to be anti-E. But let's continue as though we don't know. Then when we come to the little c, is negative, 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 okay, little c. Then we have positive, that is little c. Then you have positive on cell number 4, okay, but cell number 4 here is negative. You cancel, it can be little c. Does that make sense? Okay. Then we'll go to the little e. Little e is positive on cell number 1. Look at that, 0 on cell number 1. So we'll cancel, it can be little e. So at the moment, we're still thinking it's going to be big E. Anyway, let's look at CW. CW is positive on cell number 1. And look at that, cell number 1 is negative, it can be CW. You cancel CW. M is positive on cell number 1. The result shows negative on cell number 1. You cancel M. N is positive on cell number 1. Okay. The same thing, 0 on cell number 1. You cancel N. Let's go to big S. Big S, you cannot cancel big S on cell number 1 because it's 0 and 0. But you can cancel big S on cell number 2 because what is positive on cell number 2, while the cell number 2 here is negative. You cancel big S. Then when you come to small s show positive on cell number 1. You see? So you have negative on cell number 1, you cancel small s. When you come to P1 is positive on cell number 1, negative on cell number 1, you cancel P1. LUA is 0, 0, 0, so you can't cancel where it is 0, you go straight to where it is plus. So LUA is plus on cell number 9, but cell number 9 here is negative, you cancel LUA. Look at BK. BK is positive on cell number 1, negative here on the patient result, you cancel it. Then small k is positive on cell number 1. The cell number 1 of the patient showed negative, you also cancel small k. Okay? So at the moment so far, we are thinking it's going to be likely to be what? Big E. So let's continue. So we have KPA. KPA is 0, 0, so we can't cancel where it is 0. Okay? Then look at cell number 3 is positive, so you can cancel that. Okay? Then you continue. After that, it was 0, 0. Then the next where it was positive was on cell number 8. Okay? That is KPA. And the cell number 8 here is negative. Okay? Then you cancel KPA. See, it's cell number 8, positive, negative, you cancel KPA. Now, LUEA, okay? Positive on cell number 1, negative on the patient, you cancel. LUEB is positive on cell number 2, negative on cell number 2 of the patient, you cancel LUEB, okay? Now, FYA is positive on cell number 2, negative on cell number 2 of the patient, you cancel FYA. FYB is positive on cell number 1, negative on cell number 1 of the patient, you cancel FYB. JKA is positive on cell number 1, 0 on the patient result, you cancel JKA. JKB is positive on cell number 1. Sorry, JKB is positive on cell number 2 and negative, of course, on the cell number 2 of the patient, you cancel JKB. So you can see that so far, when you use that cancellation method, the only antibody that is left is antibody big E, and that, of course, matches the pattern. But what we've done differently, we use cancellation method, okay? That is actually the best way to identify antibody. So if you go for interview, they give you something, don't just match it. Just use cancellation method to show that you understand what you are doing, okay? Anyway, so if you use that cancellation method, you're going to see, of course, it matches it, it is big E. This is definitely antibody big E. So if you look at the enzyme, the only thing that enzyme have shown differently, the same results, the same pattern of results. So it's the same thing. The only thing that it enhances the strength of the result. It is 3 here, 5 here. It enhances the strength. 4 here, 5 here. It enhances the strength. That is all the information it has given. So if this was to be an interview, I'm going to say that this patient has antibody big E. So, but the enzyme is not one of the antibody that is destroyed by enzymes. However, it is one of the antibody that can be enhanced by enzyme. And that is why the strength of the reaction is being enhanced by the enzyme. That's the answer. Okay? Good. So, there you go. That's the answer. Okay? That's the answer. So, all I've tried to show you was the cancellation method. So, this is the answer. So, let's go to the next one. Okay? This is case B. Happy days. I showed you guys something, during my first antibody panel, part 1. I told you guys once you see 0, 0, 0, 0 in the enzyme, start suspecting those antibodies that can be destroyed by the enzyme, which are MNS and Dophi A or Dophi B. But let's still keep a blind eye on that and go by our cancellation method. Okay? Good. So let's look at this result. You are going to see that positive on cell number 1, which is big C. The result is negative here on cell number 1. You cancel big C. I'm going to try to be a little bit fast now since I've laid the foundation. D is positive on cell number 1, negative on cell number 1. You cancel D. Big E is negative, negative, positive on cell number 3, positive on cell number 2. So you can cancel it there. But let's look at where S is positive. It's positive on cell number 5. That is big E. Then cell number 5 here, 1, 2, 3, 4, 5. So cell number 5 here is negative, so you cancel big E. See it now. Then little c is positive on cell number 3. So when you are using cancellation method, pay attention to where the panel said positive. Okay, so little c is positive on cell number 3, and cell number 3 here is positive, so we cannot cancel it that way. But after that, you can say that little e is also positive on cell number 4, and cell number 4 here is negative, so you cancel it, can be little c. Then little e is positive on cell number 1. Okay, cell number 1 is negative on the patient, you cancel that little e. Okay, so little e. Then you come to CW. CW is positive on cell number 1. Cell number 1 is negative, you cancel it. M is positive on cell number 1. Cell number 1 of the patient is negative, you cancel M. N is positive on cell number 1. Cell number 1 of the patient is negative, you cancel N. Big S is positive on cell number 2. Cell number 2 is positive, so you can't cancel it there. The next place it was positive was on cell number 5. So you come to the patient 1, 2, 3, 4, 5. So it's negative on cell number 5 of the patient, you cancel big S. Small s is positive on cell number 1. Cell number 1 is negative, you cancel small s. P1 is positive on cell number 1. Cell number 1 of the patient is negative, 0, you cancel it. Okay, then you have LUA. You can't cancel where it is 0. I've already said that. So we'll go straight to where it is positive. It is positive on cell number 9. Cell number 9 of the patient is negative, you cancel LUA. Sorry, LUEA. Okay, 1 minute. You cancel LUEA, okay, which is here. Okay, sorry, I'm running faster. Then K is positive on cell number 1, negative on the patient, you cancel it. Small k, positive on cell number 1, negative on the patient, you cancel it. KPA is so positive on cell number 3. The cell number 3 here is positive, so you can't cancel KPA on cell number 3. Where S was it positive? It was positive on cell number 8. So you come to the cell number 8 here. 1, 2, 3, 4, 5. Okay, so cell number 8, just 1 minute, is positive, so you cannot cancel KPA. See it now. KPA is positive on cell number 8. The patient is also positive on cell number 8. Therefore, using cancellation method, we cannot exclude KPA. Okay, good. We cannot exclude KPA, so we are suspecting it might be KPA, even though it did not match the reaction pattern. Okay, so KPA is suspected. Let's go to the LUEA. So under the LUEA, you will see that it's positive on cell number 1, negative, you cancel. LUEB, positive on cell number 2, positive. Positive on cell number 3, positive. Okay, the next place was on cell number 6. You come to the patient 1, 2, 3, 4, 5, 6 is also positive, so you cannot cancel it on cell number 6. But cell number 7 still positive. LUEA is positive on cell number 7, and the patient is also positive on cell number 7. 1, 2, 3, 4, 5, 6, 7 is positive. So let's continue. Then LUEB is negative on cell number 8. Is positive here, you cannot cancel it that way. So the only thing that we then cancel that on cell number 9, LUEB on cell number 9, okay, is plus, but is negative here, you cancel. Okay, so that's the cancellation method. Anyway, so we'll come to the FYA 0, 0, plus, 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 plus. Okay, I already know it's FYA, so that's why I'm doing that. Okay, 0, 0, 0, 0, plus, 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 0, 0. So the pattern matches this. Okay, so this antibody is antibody FYA. Remember that we could not cancel KPA. Okay, so but FYB is positive on cell number 1, negative, you cancel it. JKA positive, negative on cell number 1, you cancel. JKB is positive on cell number 2, positive on cell number 2 of the patient, it continues. But on cell number 4, JKB positive, but the patient is negative, you cancel. Therefore, when you look at this cancellation method, sorry, I may have muddled some things up, but if you use that cancellation method, you're going to see that both KPA and FYA is what you are suspecting, but you know that the pattern exactly match FYA. So, but you cannot exclude kPa. So the answer now is that the antibody is antibody FYA, but cannot exclude kPa. Of course, you can just say FYA and kPa as the case may be. But remember, we said that FYA is one of the antibody destroyed by enzyme, and that is why you have 00000 in the enzyme. And that, of course, confirmed then that is definitely FYA. Remember that the antibody that can be destroyed by enzyme is MNS and FYA, FYB. kPa is not there. Okay, so this confirmed definitely that this is FYA, but we cannot exclude kPa. Okay, because when we use our cancellation method, there was no any place we can cancel kPa. These are the things I would like you to practice. Okay, now these are the results they've given to us. You can see it now. So you can see where I marked here match all the pattern here. So this is definitely FYA, but can't exclude antibody kPa. Happy days. So, but remember, so what you then need to do when you cannot exclude, what are you going to do with kPa? It doesn't matter. Remember, I told you about non-clinically antibodies. You see kPa there. Okay. So once you've seen this kind of result and you're able to remember non-clinically antibody, non-clinical significant antibody, just go straight and find antibody antigen FYA negative and cross match for the patient. Okay, because kPa is non-clinically significant antibody. But for these purposes, antibody FYA can't exclude kPa. I hope I've made that point strong. So that's what we've got. Let's look at the next one. So if you look at this next one, this will be very easy for us to do. If you use cancellation method, you are going to cancel everything. You will cancel everything here. Very important, because everything is zero, isn't it? Yeah, both in the I80 and the enzyme. So if you use cancellation method, everything will be cancelled. So you are going to say the person does not have any antibody. Yes, if you use that cancellation method both in the I80 and the enzyme, if you use it, you cancel everything. But look at the auto antibody. Remember that I told you when you are doing panel, you put the auto sample and use a positive sample. Go and watch the part 1 of antibody panel. Okay. Anyway, so you can see that the auto is positive. So maybe this person you might be thinking in terms of maybe the auto antibody is coating or something. So now that's why here there's elution techniques here, and we use that elution techniques here. Then with this elution technique, let us now use cancellation method on this. Okay, so here C is positive on cell number 2, negative, you cancel big C. D is positive on cell number 2, negative on the elution now. Okay, you cancel it. Okay, then E is positive on cell number 3, you cancel cell number 3 because it's negative on cell number 3. Okay, then little e is positive on cell number 1, still positive here. So on cell number 2 is positive, negative, then you cancel little c. Then little e, sorry, I think I modeled something up here. So little c is positive on cell number 3 and negative here, you cancel little c. While little e is positive on cell number 1, okay, positive on cell number 1, little e. But then on cell number 2, little e is positive, negative here, you cancel little e. CW is positive on cell number 1, CW is positive here. Where S, can you see it? There's no other place you can be able to cancel. Because of that, you cannot exclude CW on this occasion. Okay, then M is positive on cell number 1, positive on cell number 1 here. Okay, then M is positive on cell number 2, negative, you cancel M. N is positive on cell number 1, positive on cell number 1. Okay, 0, 0. But on cell number 3, N is positive, but this is negative here, you cancel N. Big S is positive on cell number 2, negative on cell number 2, you cancel. Small s is positive on cell number 1, positive on cell number 1. Okay, but then on cell number 3, it is positive, but negative here, you cancel small s. And P1 is positive on cell number 1, positive, but then on cell number 2 is also positive. This is now negative, you cancel P1. LUEA is positive on cell number 9, and cell number 9 here is negative, so you cancel LUEA. While K is positive on cell number 1, positive, and then coming on cell number 6 is positive, but it's negative here, you cancel K. Small k is positive on cell number 1, positive. Positive on cell number 2, negative, you cancel small k. KPA is positive on cell number 3 and negative here, you cancel KPA. Then LUEA is positive here, negative, 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 negative. Then it's positive on cell number 4, okay, but cell number 4 here is negative, you cancel LUEA. While LUEB is positive on cell number 2, okay, then negative on the patient, you cancel it. FYA is positive on cell number 2, then you cancel FYA because this is negative on cell number 2, okay. Then FYB is positive on cell number 1, positive, but on cell number 4 is positive while it is negative here, therefore you cancel. Then JKA is positive, negative, 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 that JKA negative, negative, negative. Then you have plus, positive, negative, 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 plus, negative, that JKA, negative, positive. So this matches JKA, okay? But remember, we cannot exclude CW, okay? But JKB is positive on cell number 2. Cell number 2 here is negative. Therefore, you see, after the elution techniques, okay, eluting the auto-antibody, they've now been able to identify that this patient has antibody JKA, but not excluding CW. Antibody JKA, this matches this, that's antibody JKA, but you cannot exclude CW. So let's look at the answer. That's what it shows you here. It is what? JKA, but you cannot exclude CW. So I'm hoping you are understanding this. So that's the cancellation method. All I'm trying to show today is the cancellation method, okay? Cancellation method, because that is very, very vital, okay? Good. So let's look at, so that is actually everything I want to teach you today, that cancellation method. So I want you to practice this over and over. I'm not going to be rushing these antibodies, okay? So the next thing I'm going to look at is when there is 2 antibodies. 2 antibodies. When it is 2 antibodies. So far we've been identifying just 1 antibody. The first part 1, I just showed you match the pattern, 1 antibody. Today I'm showing you where we don't need to just match the pattern. We're using cancellation method, including with the matching the pattern. Then with that, we can know the actual antibody that it matched, which is then the antibody, okay? And after that, we now see if there's any other one that is does not match it, but we cannot exclude it with cancellation method, okay? That then we say it is this antibody, but not excluding the other antibody. But when we say we cannot exclude it, or the one we cannot exclude, even on the previous one, where we have JKA and CW. Remember that CW is non-clinically significant antibody, okay? Therefore, what are you going to do? You focus on JKA and find JKA negative antigen and cross-match for that patient. So all I've told you today is the cancellation method. So carrying what I had already taught you on matching pattern, you still use the matching pattern, but then you use cancellation method to see the ones you're going to exclude and the ones you're going to include in your search. So we're going to be looking at this more, but then what I want you to understand that in a situation whereby, so we are not looking at the second line panel so far because the ones we can't exclude so far, they are non-clinically significant antibody. But let me give you an example. If you cannot exclude DUFI A and E, you then need to do second line panel because you must find out whether E or DUFI A is there or not. So once you are suspecting 2 antibodies, you must need to do second line panel to actually make sure you get that antibodies and make sure that they are present or not when it has to do with 2 clinically significant antibodies. But so far, the one I've shown you, I think the first one was KPA, this one is CW, that's the ones we cannot exclude. 2 of them are non-clinically significant antibody. Once again, all I'm trying to teach you today is to carry the matching pattern, but then use cancellation method. That way you can be able to say, it is not this antibody, it is not that antibody, these are the one I'm suspecting. The ones you are suspecting, which one actually match the reaction? The one that match the reaction is definitely the antibody. You can investigate the second one further, but you don't have to if it is non-clinically significant antibody. I know that this video has taken time But yes, it's worth it, to make sure you understand. So you can see the skill of identifying antibody is getting higher. Next time, I'm going to look at when it is more than one antibody. And after that, I'll look at homozygous and heterozygous antibody. Anyway, you take care of yourself. Thank you so much for listening till I come back away again. And can I please ask you guys to please, I know you are watching the video, do subscribe, okay? That will help the channel. Thank you very much till I come back away again. Bye.